Hi everyone, I'm Dr. Nadine Hamilton from Love Your Pet, Love Your Vet. Welcome to another episode in our Thriving and Surviving in the Veterinary Profession webinar mini-series. Today I am delighted to be joined by Dr. Christina Fenske. She's a DVM, a veterinarian that practices in emergency medicine down in Victoria, so here in Australia. And today she's going to be talking to us about how to look after our new graduates and our interns and the importance of doing that, and I guess trying to make it so that we can help them thrive and survive within this profession as well. So I'll let Christina explain a little bit more about that and launch into the webinar, but very warm welcome and thank you so much, Christina, for joining me here today.
Wonderful. Thank you so much for that introduction, Nadine. That was lovely. You've pretty much covered everything, so I'll just I'll get started.
No problem.
Yeah, so a little bit about me. I'm originally from Michigan in the United States, so I went to Michigan State University to get my DVM. I'm now living in Melbourne, Australia, and working in emergency medicine. So veterinary medicine is actually a second career for me. So I initially started with a bachelor's of business management. I worked in a human dermatology practice for several years, and I was kind of doing management role there, so looking after hiring, training and development, performance management, things like that. And I really did love that, but I really wanted to do something that would keep me continually engaged and interested, allow me to kind of travel the world and give me something that had a little bit more feel good to it. So I kind of have always loved animals, been interested in medicine, and people are gross. So I decided to pursue veterinary medicine. In vet school, I was a very active member of a lot of different clubs. I was really interested in the Education Innovations Committee. So that was something that was responsible for a new curriculum development, as there was a lot of questions as to why new graduates weren't practice ready coming straight out of school. So that was a really interesting thing to be a part of. And I also did a lot of travel in vet school. Like I said, I really love to travel, and I did some externships in South Africa, Chile, and Uganda as well. So I moved to Australia then to be with my partner. He just finished his PhD. In fact, he submitted yesterday. So when I got here, I worked in general practice for about a year before transitioning over to emergency medicine. And I've also done a stint as an instructor for Loop Abroad, which is a study abroad program for undergraduates and high school students that has like a veterinary and conservation focus. Unfortunately, because of COVID, we can't go this year, but I did last year, and it was really, really rewarding and fantastic. So I really enjoy mentoring, teaching, traveling, all of that. So I think, one of I'd like to kind of tell you why I'm so passionate about this particular topic, about caring for new grads. And that is not just my own personal experience, but an overwhelming number of vets that I know have had absolutely terrible and sometimes just heartbreaking first years on the job. I'm a part of a group on Facebook called Not One More Vet. And I just can't, it's just devastating to me, the number of people that post on that site about how horribly they've been treated or how unsupported they are, especially in their first year of practice. And I feel like this is a hard enough profession as it is. So why aren't we supporting our new grads better? I guess a lot of this, I would say the problem starts with the way vets are trained in school, but that's another topic for another day. So what I want to do is today I'm going to focus mostly on what I believe employers of new grads and interns should be doing, and what those new grads and interns should actually expect and maybe even demand from their new employers, so that they can look after their own mental health. So yeah, I'll tell you a little bit about my first year on the job. And this little picture of I have no idea what I'm doing is exactly how I felt for about an entire year. I was a new grad. My first day on the job, I had about an hour of intro to the clinic. And my first client was scheduled at 9 a.m. I was alone. I had no other vet on site. My nurses here were not allowed to draw up vaccinations. They had no idea how to do that, to get prescriptions ready, basically to do anything. Place catheters, draw blood. So I was the only person that was allowed to do all of those things. I really don't even know how I bumbled through that first year. It was really, really rough. I begged for another vet. I was eventually sent someone that would come in maybe twice a week to help me out. And then she quit. So I was a sole charge vet with occasionally an additional vet for basically an entire year. My mentor was working in a practice about 10 minutes down the road. And he was, very, very open to me calling him, but he wasn't physically present. And then of course I always hesitated to call him because I was burdening him and interrupting his day, because he had a day full of appointments and surgeries and things like that. Not to mention, I think the most important part of this is that if your mentor is not physically present, how can they help you with things like eye exams, urine sediment cytology, skin lesions, a neuro exam? These things are things that need another person to be there to guide you to say, yep, you're doing that correctly, or yep, you've got that diagnosis, or look at, what am I looking at under this microscope? Is this normal? Is this debris? That it's really, really tough to try to get those types of things across over the phone. And also, I think one of the most important things of that is that it's not in the best interest of our patients. So as a new grad, you do feel like, yes, you've been trained for this and everyone's like, you're going to do this, you're going to be great. But then you get there and you realize how much you don't know. And I think that puts our patients at risk, and that's not fair to them. Late nights and early mornings, I stayed at least 2 hours past close every night, typing notes, stressing, looking things up, trying to figure out, just trying to make a diagnosis on something, right? I had no time for things like exercise, social activities, healthy eating. My health physically, not just mentally, but also physically suffered. Every night, I would lay awake and replay the day over and over and over. And I would wonder, what did I do wrong that day? Is that animal going to end up dying, and being rushed to emergency because they're bleeding out from a surgery I did? Am I going to be taken to the vet board for something? Did I give the right diagnosis and treatment? Do the clients trust me, or do they think I'm a complete idiot? The anxiety, the exhaustion, and the horrible imposter syndrome that I felt in that first year of vet school, it was crippling. The mind can make up some pretty terrifying scenarios if you let it. And certainly, while I lay awake every night, there were countless times I thought that vet med was basically the worst decision I'd ever made. I'd wasted years of my life. I must, I'm in crippling debt for nothing now. And then of course, think about that. Suicidal inclinations are not far behind those types of thoughts. I think that the only reason I kind of was able to pull through that is because I already had some experience in life in terms of, successes and failures and getting back up again and all of that, because I was an adult as, going into veterinary medicine. But I feel I'm very afraid for some of these new grads that have just fresh come out and they've never had a real job yet, because they've done just school straight from high school into undergrad and into vet school, and they haven't had those, that ability to develop, resilience basically. So I really am not sure how some of these younger, vets are coping. And I know that not all of them are, and they're not coping well. So luckily for me, my story does have a light at the end of the tunnel. I moved to emergency medicine and basically demanded that I be supported. I said, I'm not coming here unless I get the support that I need and the training that I need. They were more than happy to do that. And I've definitely, I still question myself, of course, but those feelings of despair and exhaustion are certainly very few and far between now. So basically what you're going to hear from me today is, a result of reflection on my own personal experiences as a new graduate vet and the things that I think could have helped me. And then of course, the countless stories that have been relayed to me by colleagues. And I've also asked several of my colleagues to kind of give me a few ideas and things that they thought that would have been helpful for them as well. So that's what I'm going to go through today. I really do feel that as a profession, we're largely failing our new graduates in this very critical time of development. And that failure really contributes to many of the mental health challenges faced by veterinarians today. And as a profession with one of the highest suicide rates in the world, we need to do better. And I think that we can do better. There are many aspects of this profession that are inherently challenging that we actually can't change. But there are things we can change, and we can make that experience better for new grads. I do believe very strongly that resilience is the key to combating the negativity that can so easily engulf us. And I think one of the best ways we can do that, help the grads develop resilience, is to provide that supportive, encouraging environment where they can learn and grow, and it's okay to fall down and to get back up. So this talk is intended to provide specific, actionable ways for employers to support new veterinary graduates. And I hope that by sharing my story and some of my ideas, that at least one new grad vet's life is changed for the better. For the purposes of this talk, when I say employer, I'm referring mostly to the vet who will be providing the support and mentorship to the new grad in the clinic, but of course also as a whole in terms of the clinic and the culture and kind of including everyone. So from business office, manager to the nurse or the tech that's on the floor, everybody really needs to be on board. So I thought this was really interesting. I was reading through some welfare guidelines, and I was really struck by how similar they were to what I was writing about supporting new grads. So I thought this would be kind of a fun thing to do. So some of the following are excerpts from the AVMA welfare principles and the Australian animal welfare standards and guidelines, and I've replaced the word animals with new grads. So new grads must be provided water, food, proper handling, health care, and an environment appropriate to their care and use, with thoughtful consideration to their species typical biology and behavior. I think this is probably one of the most impressive and well thought out piece of, or sentence, I guess, that you could use in support of, what does a new grad need, just so your basic kind of level of things. So water, is there water? Are they drinking water? Because I tell you that there's lots of times when I wasn't, and I wouldn't eat, and I couldn't go to the toilet because I was too busy. So this is just something I thought was really impressive. And then the next one, new grads should be cared for in ways that minimize fear, pain, stress, and suffering. Again, another poignant point. New grads shall be treated with respect and dignity. I find this one is one that a lot of new grads feel they are not getting. And that's just really too bad. And procedures related to new grad housing, management, care, and use should be continuously evaluated, and when indicated, refined or replaced. So this should just be happening anyway. On a regular basis, you should be evaluating your clinic and the flow of things, and how everything is kind of set up, and is this working, is this not working? Because change is inevitable, and it's a good thing. So you should be evaluating your processes and saying, and making changes where need be. So all people who have new grads in their care have a responsibility to ensure that they have adequate knowledge, training, and skills to apply in the protection of the welfare of new grads. So when you say you read this, I think it's important to note that it's just being a vet doesn't count. So just being a vet doesn't mean you have the adequate knowledge, training, and skills to protect the welfare of a new grad. So you might have those skills and you might have the knowledge to teach them about being a vet, but do you have the soft skills it takes to protect them? So do you have patience? Do you have empathy? How are your communication skills? So look, I think the most important thing about these statements is that these are animal welfare guidelines. So the veterinary profession makes these commitments to animals in our care, animals. Why not to our own colleagues? So we've made this commitment. Why are we not doing this for our own colleagues? So one of the things that I've heard a lot of my colleagues have said this too. You've probably heard these before, things like, suck it up, buttercup, or we all suffered and made it through, you'll be fine. Or I heard this multiple times, everyone has a terrible first year out. It's always awful. Well, why? That approach is absolutely archaic and just needs to be ditched. I don't understand why we don't fight against this a little bit more. You know, we've kind of already seen where that approach is getting us and that those attitudes are getting us. You know, vets regret their career choice. They leave the profession early. They have poor physical health. They have poor mental health. And worst of all, suicide. So we do need to be thinking of ways to support people as opposed to telling them to just suck it up. A lot of focus, I feel, is put on resources and advice for the new grad themselves on how to cope and, you know, how, like, look, here's about 1 million resources for you to look at when you're stuck on a case, like go to VIN, go to a textbook, go to this, you know, or here's all your mental health support hotlines and things like that, which is fantastic, but not enough focus is being put on the education, guidance, and accountability for the employers that are actually taking on these new grads. So I think, you know, that we need to kind of go forward and let's look at some of the things that can be done for, you know, that the employers can actually do to maybe do a better job supporting the new grads, and especially interns as well. They seem to get the brunt of it. So self-awareness, a very important first step for an employer. So know thyself. Not everyone is cut out to be a mentor, and that's okay. It's really better for you to figure this out ahead of time. And you may even need to ask your colleagues, your friends, your family about, you know, you may actually just have to stop for a second and do some self-reflection on, you know, can you do this? Like, for example, the vet that I worked for, my mentor expressed great interest in mentoring me. He was so excited, but he was awful at it. So he would get frustrated if I was going more slowly than he would like, and basically just push me aside and say, let me show you, let me do it. So I didn't benefit from that at all. We watched other vets doing things in school for 4 years, right? So we now need to be allowed to practice those skills with someone at our side, cheering us on, not questioning us, you know, in terms of like not making us question ourselves, let's put it that way. I had another vet that told me that she was doing just a typical spay and she was suturing the body wall, and her vet came up behind her and was like, no, I don't do it that way. You can't do it like that. If you ever do it like that again, you're out. And she was just doing a different suture pattern that would have been perfectly fine and normal. But because it wasn't the way he did it, he made her feel awful about what she was doing. So again, you might just know yourself. How do you communicate? Ask yourself some questions. So, or ask, like I said, or ask a colleague or even, you know, a family member, and be honest. Do you get frustrated when things are not done your way or as fast as you would like? Does the idea of mentoring and teaching excite you, or could you just not care less? And I think most importantly, are you happily willing to make sacrifices to support a new grad? So happily willing to make sacrifices. And probably the biggest sacrifices you'll make will be time and money. So I've put together sort of a list of must-haves, which is of course like a little bit of pie in the sky. But, you know, patience, it's very, very simple. Flexibility. So is it okay for people to do things a little differently as long as the job gets done well and appropriately? Excellent communication skills. So, and a sense of humor, super important. Desire to teach. So do you really want to? Does it interest you? Do you like it? Do you like to wait? Do you watch the light bulb moment happen in a student's, face? I love that. So resources, do you have resources? Modern equipment, well-trained support staff. So when I say modern equipment, I realize that not everyone is going to have the most modern equipment, but you do need to realize also that these students are coming straight out of a university where they have all the toys. So they're used to having all of these things kind of at their disposal so that they can make their, make their diagnoses and make their evaluations based on that. So even if you don't have the most modern equipment, at least have equipment that works. That's super important. A good clinic culture. Fire the toxic employees. I can't even tell you the number of times I have heard about some terrible nurse or tech that has just been treating the new grad horribly, and they're very cliquey and they don't really let them into the group. That's just unacceptable. Get rid of them. They're not worth it. So clinic financial stability, that will come into play. You should definitely not be expecting your new grad to be the one to bring in a lot of money, especially not straight away. So you need to be stable going into it. And that new grad should definitely not have the pressure of feeling like they are responsible for that clinic's success. And ideally, some formal training in leadership, teaching and learning styles would be super helpful. So look, let's say you're a forward thinker and you've done some self-reflection and you feel like your clinic can properly support a new grad. Well, that's super fantastic. So let's talk about some ways that you can do this. So the basics, these are the simple things, right? And these should just be across the board for everybody. But I want, I guess to highlight these things because we do forget about them. So housing. Is your clinic inviting? So does it look like this in the kitchen when they walk in? How about the bathroom? Is it disgusting or is it nice and clean? Is the paint peeling? Like, do you have bright colors? Do you have any natural light in your clinic? Or is it just dirty, cluttered, stuffy? Are there about 1,000 sticky notes on the walls? All these are little things, but they can make a difference in terms of your day-to-day feelings about going to work. And like I said before, does all of your equipment work? So like surgical monitoring equipment, for example. So can they pop an ECG on? Can they check an SpO2? How about blood pressures? Does the light on your laryngoscope work properly? How about your ophthalmoscope, your microscope? Is that from like the 60s? Do you have a black light? Does that work? So just all these little things. Does your grad have a place to call their own? So there are going to be many clinics that probably aren't going to have the ability to do this. But if you do, it would be amazing if they had a little kind of cubby or a desk or something like that where they can put a personal effect or two, like a picture of a family or a pet or something like that. Ideally, it would be away from the hustle and bustle, but that's, obviously going to be dependent on the clinic. And another thing, is there a back room like full of old equipment that just nobody's ever going to use again, but you can't seem to let go of? Now would be the time to declutter. That would be a nice little spot for someone to step away. And then often overlooked as well, are workstations ergonomic. So my first job, I had the computer and the phone were up on the bench top, and I couldn't like sit, and there was no place for my knees to go. So, that really wasn't great ergonomically. And by the end of the day, yeah, I was definitely hurting. So some little things to think about there. How about feeding? Does your new grad get a protected lunch period? And is there a break room where they can step away from work to eat and unwind? Or maybe like a local cafe, something that's just enough that they can kind of get away for a second. And are healthy snacks provided and easily available? It would be great if you provided a fruit bowl or some sort of, maybe granola bars or something because, we're all going to get busy. We're all going to have times when we can't sit down to a lunch. So if they can grab something healthy, that's better than doing you know, what Elf's doing here in this picture, and shoving his face full of random pasta and candy. So another thing to keep in mind with this too is that most vets are very high functioning, like type A personalities, and we may, because we're so driven to get everything done, we may need to be forced to sit down or to leave it at the end of the day on time. We may, you know, to say, look, you need to take a lunch. You will go take a lunch. We might need that kind of extra push. General health. So is the new grad getting out of work on time? Do they have time for their exercise, hobbies, family? Maybe ask them, like, what types of things do you like to do outside of work? You know, and make sure that you know, see them kind of doing that. Are they getting enough sleep? So I guess, how many bags do they have under their eyes? And are they showing any signs of depression? So there are lots of resources out there on how to identify signs of depression. It's not a catch-all, but certainly I would be considering mental health first aid training. That would be at least helpful in maybe you catching those signs early enough to offer support and to intervene before something even worse happens. Enrichment. Of course, you'll need to, of course, carefully gauge their personality type and sense of humor. But like, are there any internal activities, games, jokes, things you can include them in? We do veterinary bingo sometimes in emergency, and it's great fun, and everybody just has a great time with it. We just make up our own kind of little areas that we can do, like. I can't even think of anything just now. But yeah, veterinary bingo is a great one. So plan social events outside of work so that people can form stronger bonds and get to know each other. Giving verbal praise and visible recognition for successes and hard work, I think, is super important, especially things like technical skill firsts. So your first fat bitch spay, or unblocking a cat, or a complicated dental extraction. You know, using a whiteboard can be really handy for that recognition, and putting that up and is not just showing the new grad that you appreciate, you know, them and care about them and recognize them, but it also shows, you know, the rest of the staff that you're paying attention and that you care. And I think that's a great thing. Offer a lot of CE opportunities, internal and external, because they will need to continue learning, and probably more than you even think. So this would be the meat and potatoes of the presentation. So I recognize that all the things I'm about to say are not possible within every clinic, and or they may vary from clinic to clinic, and also they may very well vary from grad to grad, depending on where that grad is at when they come out of school. So basically, this is just kind of an overall ideas that I've come up with that I think would have been really helpful for me, as well as some of my colleagues have agreed. So the support, early days, I would say at least for the first 2 weeks, have a written schedule for them on times of the day and what days you're going to do certain things. So you're going to have orientation, of course, right? You're going to orient them to the clinic, where things are, you know, who everybody is, what is expected of them in terms of time, what their schedule will be like, things like that. And keep in mind that not all, you know, your new grads may not be from the area. So what if you've hired somebody that's, you know, come from across the country? So having some sort of central, like a folder in a central location that has all of the things that they need to know about your area. So for example, useful phone numbers, police, fire departments, things like local specialty vets and emergency centers. What dog trainers do you recommend? Do you have, are there boarding kennels around that you like? What's the local shelter number? So all of the things that they can easily access and not have to go, you know, kind of constantly be asking for those things or trying to look them up on their own. Another thing to keep in that folder would be things like commonly accessed websites with the login and the password. So things like your external laboratory. So how do you look up blood results? And clinic email, for example. And also things like protocols. So what's your vaccine protocol in your clinic? What about preventatives? How about maybe even step-by-step instructions for in-house diagnostic machines, so they can learn to utilize those on their own, so they don't need to rely on their nurses or someone else to run those tests if need be. So shadowing, let them listen to multiple different vets in the clinic if that's applicable, if you have multiple vets, because everybody does stuff a little different and they might pick up on things that they like, that one vet does or the other vet does, or make a combination of those things. Of course, computer training, showing them how to put together estimates, enter charges, things like that. Also, I would suggest in this part is discussing medical history notes and what would be expected of them and in what format. If there's like a preferred format in the clinic, how do you like to see your notes, your physical exam notes and your assessments and things done? That's always good for them to know going in. And assisting. Now, this might seem a little silly or trivial, however, I think is extremely important. Assisting, such as things like placing catheters, drawing blood. You would not believe, and maybe you would because you've been there before in vet school, but the number of times that I think I placed a catheter in veterinary school was like twice. I maybe drew blood a couple of times. So we don't get to do those hands-on skills as much as we should be doing in vet school. So going out into practice, my nurses were much, much better at those things than I was. So I certainly needed the practice. So don't just let the nurses do it all the time. Let the new grad do those things and make sure they're very comfortable with it. Monitoring anesthesia, let them calculate up some drugs or come up with a drug protocol for an anesthetic, for example, and check over their stuff and say, yep, look, like there's lots of different anesthetic protocols, a lot of different types of drugs you can use for pre-medication and induction and things like that. Let them come up with plans based on looking at that pet, their size and their age and any comorbidities. And you can help them a lot by going through and letting them do that first, and you rechecking them. And then of course, running diagnostics and setting up fluid pumps. Well, every place you go, they're going to be different. So it's really good for them to get to know how the machines work in your clinic. So whereas it seems a little silly, a little bit, and maybe even the new grad might feel like they're kind of, having to do something that they don't feel that they should, it really will help them to get to know the practice, get to know the staff. They can find supplies easier, and then they can also learn the flow of the practice in general. So I really think that having them assist is really, really helpful. Support. So I guess if there's anything that I'm going to get up on my soapbox about, it will definitely be this. So never ever leave a new grad on their own. And I would say for at least the first 4 to 6 months, even longer if required. That means physically being in the building, not just available by phone, and they most certainly should not be on call by themselves at all. This is so important, and partly, I explained earlier what my thoughts were on it and why, but it's because there are so many things that we need to have you look at with us. So they should be asking for second opinions from you on pretty much everything. And I ask still to this day. I work in emergency and we almost always have an additional vet on that's, kind of like a support vet. And I ask them all the time for, hey, what do you think of this? Hey, what do you think of this? Because I think that's going to make me a better vet. And it makes you a better vet if you can have someone standing there next to you saying, no, I don't agree with your assessment of that. Like, it's like, look at this, let me show you something else. Let me show you it from a different perspective. It's so helpful. And it has made me a much better vet. So, and then I think also, importantly, that you should always have your new grads back. Take their word over a client's. Clients are not always right, and they're a dime a dozen. I'm sorry to say, but they kind of are. So if you've got a terrible client, that's treating your grad like crap, or they've said something that's very offensive, or they've treated them poorly, let that client go and have your new grads back. It's really, really important for our sanity as veterinarians, as a whole in the community too, in the profession, that we don't tolerate abuse from clients. It's not okay. And I think if you do this too, basically showing them, you need to show clients that you support and respect your new grad and that you expect them to do the same. Teaching. So client communication. So we don't get a whole lot of this either in vet school. So how to communicate those physical exam findings, the diagnostics, the treatment plans, the costs especially. That is a really big thing that I think many new grads really struggle with, because you want to fix everything, and you don't want it to cost as much as it does, or you don't want to tell the owner how much it's going to cost to do all the things. And there are many ways that people can communicate that. So it depends on, kind of, do they know how to do it? Are they comfortable with it? And do they sort of have like a plan of attack, right? So I like to utilize kind of a way of explaining pros and cons and consequences of different diagnostic and treatment options. So you can go to the client and say, okay, so your dog, let's say your dog's had been vomiting now for 2 days. Okay, well, this is pretty serious. That's absolutely abnormal. And I'm very concerned about your client, about your pet. And for the best way for me to go forward, or for us to find out what's going on, we need to do, this, barrage of tests. So we need to do x-rays at a minimum. We need to do blood work, this types of stuff. And that will give us the most information. And if we don't do that, we could miss something. So we could miss a foreign body obstruction that literally could result in the death of your animal. So later your pet, so there are ways to kind of go about explaining things to clients that don't necessarily really focus on the cost of it, but more on the benefit of what you're doing for them. And I think that can be really helpful. But again, everybody sort of has their ways of doing it. So offer your own tips and tricks on how to deal with clients and how to talk about costs and things like that. And I also certainly would recommend potentially doing professional communication training for these guys, because it is very nice to have those kind of, from a professional standpoint, the evaluation of how you approach things. So Allison Lambert of OnSwitch is really fantastic. So we've gone through that in emergency and learned how to sort of, how your approach changes how the client views what you're doing and the value of what you're doing. So if you have this, if you're able to do this, I think this would be a super important thing to do. New grads really do not, in vet school, we really don't get enough communication training. So this is something that would be helpful. One of the most helpful things I've ever had is protocols. So I didn't know that these types of things existed until I went into emergency medicine, where they have these protocols, and I was absolutely blown away by how amazingly helpful these are. If you don't have written protocols on how to manage common conditions, you do it. It's absolutely worth it. They do take time and effort to create, but they're absolutely worth it in the end. They allow you to create a guide based on how your clinic works, what supplies and medications you carry on the shelf. And they are absolute time savers and lifesavers for new grads and their mentors. Because if a new grad can go to a protocol and they can read all of this shouldn't be more than 4 or 5 pages. If they can read through this, there really are going to be very few questions that they're going to have. It's almost like ABC, follow the instructions. And I just can't even talk enough about how amazing having protocols is in practice. So some of the examples, for example, that I've got here are toxicities. So we see a lot of that in emergency, but I know you see it in a GP too. So, oh, well, my dog just just ate a bunch of rat bait, or my dog just ate a bunch of chocolate. My cat has been chewing on lilies. Those types of things, or acute abdomen, fluted, congestive heart failure, diabetes. Going through the pathophysiology of these things, the clinical signs that you're going to see, what are the differentials? So if something, kind of shows up with, this sign, for example, like dyspnea. So you've got an animal with dyspnea. Okay, well, let's go through, like, what are the things that you should be thinking of, and just list those out really quickly. And then you want to talk about, what are you going to find on your physical exam? What diagnostics should you be running? Like, what are the most important things for you to be doing straight away with that? And then how would you treat it, and how should you go about treating it? Those protocols were, basically complete lifesavers to me. And Vincyclopedia is super helpful. So you can actually, if you are kind of struggling on how to start with a protocol, go to Vincyclopedia and just look up one of those common conditions, and you'll be able to kind of use that as a guide, and then maybe make changes or additions to it depending on how your clinic works. So, and the other thing to kind of tell your new grads is that this is a little bit off the topic, but it is okay to refer. So generally I kind of took the path of 2 to 3 times and I'm out, like, in practice. So I would say, especially with things like skin. So you've tried this, you've tried that, they keep coming back, they're still having issues. It is the right thing to do for the patient to refer them to a dermatologist. So, and instead of having that client keep coming back to you and you're just putting a Band-Aid on something, it's okay to refer. And I think that new grads need to know that, like, you can't fix everything. And you're not going to fix everything, and especially not in one visit, that's for sure. So that's something else to keep in mind. So daily routine, start with about 30-minute wellness vaccine appointments and 60-minute sick appointments. It will take them that long. Continue those consultation times until it's apparent that the new grad does not need them. And by that, I mean, they will finish all of their diagnostics, their clinical notes, they've prepared the medication, they've sent that client out of the building, and they still have time left over. That is when they're ready to move on, and they're ready to kind of reduce their appointment times. One of the things that I've done in emergency that's helped me tremendously to speed things up is to create a Word document that you can keep open on the desktop. And you could have your physical exam template on there, your differential lists for common conditions and blood work findings, and really anything else that can be copied and pasted into records is super, super helpful. I do have a handout that goes along with this talk, and you can see at the end of it, kind of the appendices basically. I've put in there what I'd use for my physical exam template, and also a couple differential list examples. So those are things I can just copy and paste into my record, and that's super helpful time-wise. So also, obviously, regularly follow up and ask the new grad what is and what isn't working, and listen to their feedback, and be flexible and open to change. I think, doing a trial, offering to do a trial of something is just that. It's just a trial. It's not a life commitment. You don't have to do this forever. But I don't know, like, what would be the downfall of trying something new, like a new routine, a new schedule, a new roster, a new surgical day or time. There's really no harm in trying those things and seeing what works, because not everybody fits, into the same mold. So it's okay to do that. You will need to reduce your schedule to allow for more time between consults, and to provide the hands-on support that your new grad needs, especially during surgical procedures. And I guess, be prepared that you may even lose some revenue in the beginning, because you have to reduce your schedule to help them. And that should be okay. That goes back to being financially stable to begin with. I think that's super important. A daily debrief. So giving feedback is super important. So at the end of the day, have a scheduled time so that you know that that time is set aside for this. And of course, you may or may not need it every single day, but look at that new grad's cases. Give them constructive feedback. Like if you're just doing some wellness vaccine appointments, you might have much to talk about. But if you have some sick patients, you should really be looking through the blood work and the imaging results, and you should be able to kind of determine whether or not they've made a good diagnostic decision, if they've made the right treatment option, and you can have a really frank discussion about that. The most important thing I think about doing this is that if you can ensure that they haven't missed something, or you pick up on a mistake that has been made, you will prevent a lot of the guilt and imposter syndrome that will happen with these students or these grads, and definitely what I had gone through, because no one was looking over my stuff and having these conversations with me, and so I constantly questioned whether or not I was doing the right thing. And I was like, if I missed something, I'd be like, I can't believe I missed that. I'm the worst vet. Like I'm just terrible. So you should be looking at those things and making sure they haven't missed something, because if they have, you can say, oh, did you notice such and such? And if they say, oh, no, I didn't, you're like, oh, okay, well, let's talk about that, because that might change some things about, the way you approach the case. And again, you don't have to be, don't be mean about it, constructive feedback. So having a discussion, a frank, open discussion that doesn't condemn them for missing something is super important. Again, then a monthly check-in would be the next step, right? So away from the clinic would be ideal, and consider scheduling those meetings with someone that I would consider an outsider. So when I say an outsider, I mean someone that must adhere to confidentiality. So a mental health first aider, a consultant, maybe an external mentor that they have, chosen, or that could be assigned to them. But they need to be able to express themselves freely and not be worried about what's happening at work, or if they'll be, judged for it, or be held against them later. So, okay. Take a deep breath. That's a lot of stuff to consider and a lot of stuff to implement as an employer. So what do you get out of all of that as an employer? So first of all, probably the most important thing is the knowledge and satisfaction that you played a large part in the development of a competent and resilient veterinarian. That, I think, should just make your heart sing. But if that's not enough of a reward, we can let the money talk. So turnover is expensive. Happy employees are more likely to stay. It's as simple as that. A new grad who's well-trained and supported will become a key source of revenue for you. So yeah, you may have lost a little bit when you took them on for those first couple of months, but I guarantee you, if they're well-trained and supported, they will be more confident. They will sell, quote unquote, more diagnostics, and they will be a better source of revenue. And then, of course, physically and mentally healthy employees are more productive. That has been shown time and time again. So these are the benefits to you. Not only do you get to help a new grad live a good, healthy, happy life in this profession, but you also get kind of that financial productivity that you're also looking for to help your clinic carry on. And then, of course, benefits to the new grad, kind of endless: a sense of security, value, camaraderie, meaningful knowledge, and skill development. So things that they will actually hold on to, instead of just that fleeting, like, I looked this up in a textbook real quick, I'm moving on. I'm never going to remember that. But meaningful knowledge and skill development, because you've given them the time to think through things. Confidence and personal growth, good physical and mental health, and space to develop resilience. I think that is seriously one of the most important things that we really need to focus on. So the American Psychological Association's definition of resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And honestly, when I read that, I couldn't believe it. That sounds exactly like a day in vet med, doesn't it? Significant sources of stress. That is pretty much every day in vet med. So I think that it really is the key to improving mental health in veterinary medicine, is the development of resilience. And the only way that that is going to happen is in a supportive environment. And it is if an employer is willing to make those sacrifices and to do self-reflection, to kind of take that extra step to get some training for themselves to ensure that they are providing the right environment and the right training for the grads to succeed. So to wrap it up, I believe that a commitment to the welfare of new grads is an investment in the future of veterinary profession and could very possibly even save lives. So thank you for listening. I really appreciate your time. Feel free to contact me with any questions or suggestions. I'm happy to chat about any of the things that I've covered today. Thank you.
Thanks, Christina. And hopefully you can hear me okay.
Yep.
Yes, my headset died
Oh,
in
no.
the last 10 minutes. And I'm like, oh my gosh, I can't get any sound, even unplugging my headset. I'm like, I can't hear a thing. Oh my gosh, how am I going to wrap this up? And so I just had to join in through my iPad. I'm like, okay, go to plan B. So I'm like, oh my gosh. So I missed the last about 10 minutes because I was going, oh no, I can't do anything. So I know, I think it might have killed the kill switch or something in my computer. I don't know. So
That's all right.
Perfect timing. I got in because I couldn't hear anything. So I just connected right in the nick of time just to get back in there. So, but yeah, that was absolutely fantastic. And I think, you know, I was making some notes as I was going with some of the points that you raised. I think firstly, you know, when you were talking about not one more vet and how many interns sharing their experience from, you know, not one more vet, I think that is really, it's quite upsetting to see that, you know, like you put so much into this degree and there is so much excitement and passion and motivation starting out, you know, to have that dampened so quickly is really, that is really, really sad. And I think, and as a separate thing, congratulations to your partner submitting his PhD yesterday as well. I know what a big achievement that can be. But I was quite horrified actually to hear about your experience as a new grad, like your first day on the job. You know, an hour of training, be thrown in there at 9 a.m. Like that is just incredible to see that. And it makes me wonder, is there a disparity between what the practices think you're being taught at university or what the universities aren't preparing you for in the real world? But you know, I sort of think any job, whether you're a vet or you're not a vet, you know, any sort of job when you start, you know, you should always have that easing in time, you know, going through your inductions and having time to settle in and learn where everything is and learn how to, where, you know, where all your protocols are and all of those sorts of things, not just sort of throw them in the deep end and expect them to just wing it, you know, and that was quite astounding to sort of hear a first-hand account of how that's actually happened.
Yeah, definitely. I think there is quite a disparity for sure. And I think that maybe when vets have been out for, you know, several years or whatever, however long, and then they become employers, they forget about, you know, they forget over that time about how terrifying it is when you first get out and the things that you think you know but you don't really know.
But you don't.
So and I definitely, like I mentioned, as well as this being a completely other topic, but you know, I think that vet school is certainly not preparing students appropriately for like they're not practice ready, like they're not first day practice ready by any means. And I think that again that's kind of something that needs to be addressed as well. But that's a really big project.
Absolutely, it is, and it's it's a global issue, isn't it? Because I mean, these
Absolutely.
issues with the burnout and the high rate of suicide are a global thing. It's not just limited to one particular country or one town
Yeah.
within a country. You know, and I think you hit the nail on the head too when you said, you know, the mind can make up some pretty terrifying scenarios if you let it.
Yep.
You know, I just thought that is so true. And we've probably all gone there and all had those things where we start to catastrophize over everything, and then we start ruminating over it. Like you said, you know, the things keeping you up at night, you know, you're getting home and there's this animal that I've just operated on going to bleed out, and,
Yep.
you know, all those sorts of things that it just never stops. And I think, I don't know if it stops or maybe just slows down the further on you progress in your career as well. I don't know, you know, that it's just exclusive to being a new grad or being an intern, you know, because I hear from so many vets that this is something, you know, you are constantly worrying. And I think, you know, when we are working in those helping professions and we are helping other people, it is something that, or in your case, animals, it is something that we think, oh my gosh, are they going to be okay? Or, you know, what's going to happen? Are they all right? And, you know, and I worry about some of my clients sometimes as well when I know that they're not in the best place. You know, it is a worry.
Yeah, absolutely.
But
yeah, I think, you know, I think for, like you said, in the helping professions and like in any sort of a profession where you have someone or something's life in your hands in a way, you know,
yes.
that those stakes are so much higher.
Absolutely.
So we do, you know, I mean, I think that certainly, again, like, and I said too, that there's a lot of inherent challenges in this profession. And that is one of them, that I think that no matter what, you're always going to worry about your patient. Like you're just, you know, and that's okay. But it's really about how do you manage that?
Yes.
Yeah. Like, does it drive you into like, you know, a tizzy or despair? Or like, you know, what does it do to you? I mean, your worry, and how much does it take over your life?
Yes,
yeah.
exactly.
Yep.
It's being able to accept and acknowledge that these things are going to be there, but we don't have to let it define us and control us, you know, every moment of the day. So, and I love your AVMA guidelines adapted for you guys. I thought that was just brilliant. Yeah, and it's so true. And like, to me, it seems so straightforward. Like what you're laying out there does not seem that hard to do at all, and it should be for everybody coming into that workplace, you know, and starting in there, like those basic needs that we all have. How hard is it? Like, clearly it's either very hard to do, or it's just that people don't have the knowledge to be able to do that. It's like not knowing where to start, or not having the time to put into it or even think about it. And then that then sort of exacerbates it, rather than thinking that, okay, look, because as I said, it doesn't seem hard to be able to put those things into place.
It doesn't, right? It really doesn't. But I think it is like I said, I do believe that there hasn't really been a focus put on the employers and the people that are actually hiring new grads. Like, I think that there's not enough resources out there for them to try to determine, number one, can they properly support a new grad before they even start? You know, I mean, those are things that need to be evaluated. You need to evaluate your clinic. You need to evaluate what kind of time do you have to give? What kind of flexibility can you allow in your clinic? Are you financially stable enough to do that? There's just a lot of those things. And then again, you go into a lot of the soft skills and things that, you know, just being a vet, of course you've got all the skills, you know, to teach them to be a vet, like medically, but do you have the rest of the skills that are necessary to support them mentally and emotionally? And, you know, like, so I think that those things really need to be focused on, and we really need to take that into consideration when we look at hiring someone, especially.
Absolutely. And what a big difference it could make. You know, like thinking of that, like as you were talking, and, you know, sort of listening that and picturing that happening, I was sort of thinking, if I was a new grad coming into that situation and I had all of those resources and all of that support, I would feel supported going in there. You know, and it's hard to imagine that not happening, but obviously it does. But it's hard to imagine that it doesn't, and it's it's quite astounding, really, isn't it, to think that It's something so easy, and an easy shift. It might not fix everything, but at least, you know, it's a really good start to get that support, particularly, you know, when we know that, what is it, the first 3 to 5 years of after graduating are those years, that's when a lot of the vets are leaving practice, you know. So it is, you know, that new grad experience can make or break the perception of working in this profession. So
yeah, so if you start out the way that I did, I mean, think about,
oh my gosh,
the burnout was very real, and
absolutely.
I definitely can see why people want to leave this profession. Like, I mean, I couldn't, I just thought there's no way. I'm like, I can barely, like, I'm barely like hanging on, you know. And
yes,
and like I said, I think the only reason I was really able to probably pull through it more easily than some others is because I've had the real life experience. But
yes,
a lot of these new grads and interns haven't.
No, straight out of high school into uni, you know, doing their study, and then thrown into these situations, dealing with a lot of trauma, you know, a lot of stress, a lot of pressure, and then add on to that a lot of the personalities and behaviours of the clients that are coming in that you know, we're not always prepared for. And I think that, you know, when you said there that everyone has a worst first year out. It's sort of like, well, just because that's the way it's always done, it doesn't mean that's the way it needs to remain. Like that should be the exception, not the rule.
Yeah, absolutely. And agreed. Why is that? Why? Like, why does it have to be that way?
Exactly.
I don't understand why you know, why that is so difficult to, so that's what I'm trying to get to the bottom of is, you know, why is this? Like, what is the inherent problem underlying, you know, why aren't these new grads being supported better?
Exactly.
You know? So I just wonder whether or not it's because the awareness hasn't been there for the employers, and like the resources haven't been there for them.
Yes. Yep. Absolutely. Absolutely. So I think, I mean, you've raised some really valid points and shared some pretty scary stories about your own experience. That just takes the cake. To hear that, it's like, oh my gosh, like, it doesn't surprise me, but it probably astounds me to think that, you know, that was it. And again, that assumption, okay, well, you've graduated, so you're ready to go and just step into the real world without any support. You know, it's definitely would have been challenging, I'm sure, but it's good, you know, when you said that when you moved into emergency medicine and then demanding that support, you know, and I think, stepping up and being assertive. Why not?
Well, that's really hard, again, for younger, you know, graduates who have not had to do that before in their lives necessarily, you know, and they think that whatever is offered to them is the best they're going to get, you know, or they don't feel that they could ask for more. So I certainly, you know, this talk was too long to include all the things that I would like to say to the actual new grads themselves. But yeah, I mean, I certainly think that new grads need to be like literally demanding these things and saying, like, going in and saying, look, I want this kind of support. Like, show me what you're going to do for me, you know, and it should be a written like program. And if they don't have it, then move on. If they don't consider
your options.
If they don't have it, or they're not willing to make, you know, some sort of a plan with you on what you need, then I think they're not prepared for you. They're not ready, and they're not going to treat you the way you need to be treated.
Definitely. So, and I think that's it, you know, and I tell people that not just in this profession, but generally in, you know, my last jobs where I was doing a lot of careers work, that just because you're going for a job interview, even if you're offered that job, you don't have to accept it if it's not right, but you're also interviewing them. You want to make sure that this is a good place for you to work, you know, that's going to be able to meet your needs. And if it's not, it's okay to walk away and wait for the next opportunity, because at the end of the day, you know, you might be really, really desperate or really keen to get a job, and it might be the only job that you've been offered in some time, but it doesn't mean that that's going to be the best move, because you don't want it to end up being worse and creating more problems down the track than necessarily. I mean, I always say, listen to your gut, you know, listen to your instincts. What is your gut telling you when you think about that? If that makes you feel sick, that's usually an inclination to walk away, you know, but not everybody listens to their instincts, but, you know, it's something I think we can all start to do a bit more.
Yep, absolutely.
So, yeah, so thank you again so much. We do have a handout from Christina's presentation, so we'll link that onto the website where all the webinar listings are and where the link is to access this. So if you've already accessed this, you may have gone directly into our YouTube channel, or you may have gone through our Love Your Pet, Love Your Vet website, but there will be a link under Christina's presentation details there to the handout, so we'll make sure that that's uploaded. But yeah, I just wanted to say thank you again, Christina, for a fabulous presentation. You know, it's such an important area, and I think we really need to make an effort, a conscious effort for looking after those new grads and interns, you know, to help them have the longevity to stay in this profession, because they're the people that are going to be here and sort of the future, I guess, of this profession as well.
Yep, absolutely.
So,
awesome.
Yes. So thank you again so much. And I hope everybody that you enjoyed this session and got a lot of information out there. Even if you're not the practice manager or the practice owner, you're potentially someone who's going to be working with a new grad or intern. And these are all, you know, strategies that we can make sure are there to be able to help them and support them, whether they're your co-worker, whether they're your superior, or whether they are your employee. You know, so it's just helping each other to be able to adapt and really be able to thrive as well as survive within this profession. So thanks everyone for joining us. I hope you've enjoyed this, and we'll see you on the next webinar. Thanks everyone. Bye.
Bye.